Hello, my name is Dr. Delali Fiagbe. I'm a child and adolescent mental health fellow with the Colchester East Hands Health Center in Nova Scotia. I'm very happy this morning to have a brief talk about what ADHD is. ADHD is a very interesting disorder that children suffer. It's usually happen between the ages of 3 to 6, um, but most of the people get it before age 12. Okay, so the 3 to 6 is not cast in stone. And how do you know somebody has ADHD? Like the name suggests, there must be attentional problems. Okay, so to have attention is to your ability to focus on a task from start to finish. Um, there shouldn't be any interferences at all. Even if there were, it should be manageable. But some people persistently are unable to focus on a task or on assignment or a project from start to finish. There's a problem with how they process things. The other important symptom is their hyperactivity. Okay, so they may have a challenge sitting still, and to go from one aspect of a task to the other might present them with a huge challenge. So you find them, moving from one face to the other, moving from one side of the room to the other. If they come to my consulting room, they'll virtually touch every single object on my desk. It's one of the basic giveaways for a child who cannot just sit still, but struggling, to keep their urges and their feelings. The other thing that they may experience is it's what we call impulsiveness. Okay, so that impulsiveness is also part of the hyperactivity spectrum, but usually what you find is that they are not able to, sit still and get and wait for their turn before they do anything at all. So this might be a very big challenge to kids. And if you have a child like that in school, it must be difficult for them to focus in class, listen to the teacher, grasp the knowledge and the philosophy the teacher is trying to pass across to them at the very age. And 3 to 6 are the formative years of life. So if you're not able to grasp things very well, it may present with some problems in the future. Now, how do we make the diagnosis? The diagnosis is very interesting. We only make a diagnosis based on assessment by the teacher or the parents. And this is why we do that. If you meet the doctor in a room, you might in the consulting room, the time of interaction may just be like maximum an hour. Okay, that is not enough to be able to make a diagnosis of a behavioral problem. So the best thing to do is to find out, give specific questions with high sensitivity to parents and then to teachers. So we send those questionnaires to the parents and then to the teachers. And we ask them to take their time and fill them out for us. It's basically because they have enough exposure to the child. They know the child from when they started school and when they leave school and all that. So they have wealth of information about the child to give us the adequate and precise information that we need to make the diagnosis. So when it comes, we will review the domains where there are challenges and then aggregate a score and decide whether the child has ADHD or not. These are very critical assessment which need to be done because it has an impact on the life of the child. Now, if the diagnosis is made, how do we manage? The management is pretty simple. Because it's a behavioral problem, so you need to use behavioral cognitive skills or cognitive modalities of treating the problem. And usually, if that doesn't work, then of course we can defect to medication. So we'll send them to a psychologist who can come up with a plan to see how to reprogram the child's way of looking at things and perspectives of our life, and then give them skills how to pay attention, how to grasp things which are taught. The other aspect of the cognitive therapy has got to do with the family, because the family and the teacher also need to be part of the therapy. Okay, so you need to teach them how to handle these children while they're in school and handle them while they are at home, so that you're able to, reduce the symptom score. Um, so after that is done, if the results are not so good, you have like 5 to 6 sessions, and the child is not still pulling through, or they have mild to moderate symptoms which are not improving, then of course you may have to think about using some medication. Okay, so if they have severe symptoms that will not go away with behavioral therapies, we may have to look for medication. The medication which are available includes bifenthrin. Bifenthrin is a methylphenidate derivative. Basically, what it does is to improve or increase the level of dopamine in the frontal part of the brain, the frontal lobe. And what that does is to just give the individual or the child salience, so they are able to decipher what is good to do and what is not good to do. They're able to take charge of their own actions. There's enough dopamine, it allows your reasoning to go a bit more, and then it reduces their urges and the anxiety that goes with when they have these urges to act in the manner in which they do. The other one is Vinus. Vinus is also in the same class, and then there's also Adderall. Adderall is an amphetamine, and they eventually also increase the levels of dopamine in the brain. So these first two constitute the first line group of treatment. The other second line group of medication include guanfacine, atomoxetine. So these are other drugs that can help reduce the hyperactivity, improve your attention if the first set do not work. And then in school, there are a lot of accommodation which have to be done. I mentioned earlier on that at the point, the school or the teachers are roped in to be part of the therapy. Okay, so they need to make some accommodations for the child while they are in school. So they are also able to deal with their emotions, know how to answer questions, know how to give questions to those children, and give them like a bigger space to be able to work and live out what they're expected to do. Now, having said that, it is important to also know that when we start treatment, there are some challenges that these children might face. Okay, some of them may have reduced appetite. The appetite may go low for a while, and so they may not be able to eat much, and they may lose a little bit of weight, but with a little bit of encouragement, they're able to do well. Some may also have sleep deprivation. Okay, so they may not be able to sleep well within the first few days, and it's important to notice that it's not across the whole time of taking medication, but usually during the first few days of start of medication, that is when they tend to have these sleep and these side effects. But usually beyond that, they get stabilized and their symptom control gets a lot more better. I'd like to bring this conversation to an end. Feel free to share, feel free to like, to comment if you have any question that is bothering you about ADHD. Looking back, based on what you've heard now, looking back, you may be thinking that maybe I also may have had some symptoms of it. You are not sure whether it is still persisting into adulthood and you want some help. Feel free to reach out, and we will be there to help you. Thank you.